Thank you for that, Maddie. As you just heard, Maddie gave an overview of the critical analysis of Speech Pathology Australia's Clinical Practice Guideline on Alternative and Augmentative Communication, or AAC. I will now detail some of the recommendations made by Speech Pathology Australia and how they have influenced the development of our resource. And Andrea will then continue by detailing the specific recommendations that form the basis of our resource. So as we know, speech pathologists are communication specialists. This is reflected in Speech Pathology Australia's Clinical Practice Guideline on AAC and is an element that needs to be considered in AAC service provision. One of the key recommendations of the guidelines is that it is the position of Speech Pathology Australia that working in the field of AAC is within the scope of practice of speech pathologists. Communication comes in various forms. In fact, speech conveys only a small percentage of our overall message. People who have complex communication needs or difficulty communicating often depend on AAC as their main method of communication. There are many different ways to communicate messages. Therefore, as communication specialists, we are one of the most equipped professionals to provide services for people with communication difficulties. Delivery of speech pathology services is imperative to the quality of life and functional outcomes of people with complex communication needs. However, this may be difficult for some speech pathologists, especially new graduates who lack experience in the area. Therefore, it is paramount that these clinicians have access to a resource that can provide support and guidance in delivering functional and high quality AAC services. This provided the context for the development of our resource to assist professionals in implementing high quality services in AAC. The Clinical Practice Guideline by Speech Pathology Australia also recommends using evidence-based practice in AAC. The CPG or Clinical Practice Guideline states the association supports an evidence-based practice approach to the assessment, intervention and outcome measurement in the provision of AAC and other supports for people with complex communication needs. Speech pathology clinicians working in the field of AAC should use the best available evidence to support practices. In saying that, however, as AAC is a relatively new and very broad field of practice, the scope of clinical evidence is limited, unfortunately. Clinicians therefore should aim to use evidence-based practice when it is available and contribute to the long-term development of AAC evidence. In circumstances where there is no high-level evidence base available, clinicians need to use their best clinical judgment to provide intervention for those with complex communication needs. The resource we have developed is aimed to assist clinicians to develop services that incorporate an evidence-based practice where possible. There is often a need for clinicians to make judgments based on experience and clinical judgment alone, and this is where our resource aims to assist clinical decision making, especially for new graduates. As previously touched upon, AAC is a relatively new area of practice. Speech pathologists can provide education and support to other speech pathology clinicians, other healthcare professionals and the broader community. This is another key recommendation of Speech Pathology Australia's Clinical Practice Guideline on AAC. The need to educate other speech pathologists on AAC practice is paramount. Many clinicians may go through their working career without encountering people with more complex communication needs. Say if someone deals with minor speech impairments in children alone. Therefore, when this happens, clinicians need to be able to access education, whether it be in the form of presentations, resources or mentors, to provide them with the appropriate AAC knowledge to work with their client who has complex communication needs. The resource aims to educate and inform speech pathology clinicians, especially new graduates, on providing functional and best available services. Other health professionals such as doctors and other allied health team members will inevitably come across people who have difficulties communicating with just verbal output alone. It is our role as speech pathologists to educate and provide support to enhance communication between AAC users and their communication partners. This is similar to the community. People who have difficulty communicating have every right to communicate effectively. It is our role to advocate other people, which is reflected in our resource. Whilst these recommendations are key to providing good quality services, they were not the fundamental recommendations that underpinned our resource. Andrea will now go through the key recommendations that underpinned and form the basis for the resource. Thank you.